So you've been told that the only way to fix hammer toes is with a surgery, and that's true for the vast majority of cases. And you don't want to go through the surgery because there's a long recovery and you have to take time from work. It's going to cost money. But did you know there is one procedure that you can have done in your podiatrist's office? It's a less than 5-minute procedure. You just get numbed up, you walk out of the office, and in a week, you're feeling pretty good, and you're back to normal. Well, I'll share that with you in this episode. There is one catch to it, and I'll share that with you as well. Hey, it's Dr. Gaffney, saving you time and money in your foot health decisions. So hammer toes, they can be flexible or rigid. They can be very complicated. There's a lot of little structures that have abnormal function and that cause the development of a hammer toe. And there's one type of hammer toe that's relatively straightforward that can be fixed with this simple procedure in the office, and then you're relatively back to normal in a week. And that is called the percutaneous flexor tenotomy. And it's done without a large incision and under local anesthesia in your doctor's office. And it works best with a flexible hammer toe, specifically a claw toe deformity. And that's the caveat. It has to be flexible and it has to be a claw toe deformity. There are so many different types of hammer toes. They can be really complicated. But if you're lucky enough to have this simple hammer toe, this procedure will work great for you. A claw toe deformity is just what the term says. It looks like the toe looks like a claw, and that's usually related to a tight flexor tendon, like that is right underneath the skin at the sulcus there where the toes meet the ball of the foot. So how you know if you have a flexible claw toe is if you take your fingers, and if you can easily straighten that toe out with minimal resistance, then this procedure might work for you. So how that procedure is done, you go to your doctor's office, they numb you up at the base of your toe, and they take a 18 gauge needle and they puncture at that sulcus where the toe meets the foot, and right underneath the skin is the flexor tendon. So you put that 18 gauge needle in there, which is almost like a mini knife, and you move it to the left and to the right, and it severs that tendon. You can feel the toe just straighten out, and then your hammer toe is gone. That knuckle is nice and straight. You don't have any pressure at the knuckle or at the tip of your toe anymore. The procedure is marvelous. Patients love it. Doctors love it because their patients love it. There's a fast recovery, and most of the time you don't have to worry about things afterwards. Care is very easy and simple. Most of the time you're back on your feet in about a week. I usually have the patient just dress that area for about a week, but it's just a little tiny hole that seals up within the day. It's sort of like the hole you get from drawing blood. And then I also have my patients wear a Crest Pad for about 4 to 6 weeks so that when that tendon tries to heal, it doesn't find the other side and pull the toe back again. So the type of Crest Pad we have is like something like this or like this that you put underneath the toe and it'll hold the toe up. The primary complaint I get from some patients from time to time is that they tell me I made their toe longer, but that's because instead of it all curled up, it's straightened out. So it does look longer to them, but I didn't add anything to their toe. But it straightens out, and then you don't have those knuckles bothering you anymore, rubbing in your shoe. The end of the toe doesn't rub it anymore. So it does work fantastic. So if you think you have that type of hammer toe, go see your podiatrist. They might be able to do that simple in-office quick procedure, have you back on your feet and your toes feeling much better.
Hey, if I've given you some value, if I've helped you at all, please like and subscribe to my channel. I'd appreciate that very much. Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.